Um, Wonderful. I think next we have Professor Parasidis.
Hi, good afternoon, everyone. My name is S3 Parasidis. I'm a professor of law and public health at Ohio State. It's a pleasure to be here, so I appreciate the invitation. In thinking about a compensation fund for research-related injuries, it's clearly important to look at existing healthcare funds like the VICP and the Countermeasure Injury Compensation Fund. But I also think it's important to look at other fund programs like the 9/11 Compensation Fund, the BP oil spill, and even mass tort settlements like Agent Orange and asbestos. Each provides, I think, really helpful lessons on thinking about, what is just, what is fair, what is equity, but also the challenges in thinking about actual compensation figures in valuing both injury and life. Ken Feinberg wrote a great book about the 9/11 Fund on valuing life, which I really encourage folks to take a look at if they haven't. Now, here, obviously, I won't be able to go into a lot of detail, but I wanted to just focus on two things. The first is to look at some problems in the compensation funds for vaccines and countermeasures that ideally wouldn't carry forward into a research injury compensation fund. And the second thing is to dive a little bit into more detail on some ideas for how to think about structuring an research-related compensation fund. So with respect to vaccines and the VICP, I think Renee did a fabulous job outlining some of the problems. One point I'll maybe dive a little bit deeper in for a minute is looking at causation and the problems of identifying causation. So in 2012, the IOM wrote a very comprehensive report looking at 158 potential vaccine-induced injuries. And what the IOM found then was that for over 80% of those injuries, or potential injuries, more data were needed to evaluate causation. And one of the takeaways from that report was there needs to be a lot more adverse event reporting and more active surveillance and assessment of injuries post-vaccination. That didn't end up happening, in part because of the FDA and CDC's large reliance on passive reporting and surveillance. But when you couple that with the really high bar for proving causation on an off-table injury, which Renee talked about, it really creates almost insurmountable hurdles for those few people who are injured when it comes to proving, again, causation and therefore getting some compensation. So one way to think about a research-related injury compensation fund is not to put the immense burden on the injured research participant, but to think about shifting that burden more to the research institution, where if there's some credible evidence that an injury is research-related, then the institution is the one who has to show that it was not research-related. So again, this would err, of course, on the side of overcompensating. I think personally that's ethically appropriate when we think of what research participants bring to the study and to society in general. I also think it's more in line with legal requirements that think about, again, the idea that volunteers are looking at these research studies and in trying to think away, pulling away the tort. Michelle will talk a lot more about tort claims and how hard it is to bring those claims and how inefficient they are in many respects. And relying on tort law, I personally don't think is a very good avenue to think about research-related injuries. Most of these cases in practice will never get litigated. And those that do, a lot of the money will go to attorney fees, costs, and it will take a really long time. So that's one thing to think about, hopefully not carrying forward from the vaccine fund. With respect to the Countermeasure Injury Compensation Fund, I'm not sure everyone's familiarity with this. This dates back to 2005 after the Bush administration instituted a smallpox vaccine program, which was fairly controversial. It really came into the public limelight during the pandemic with the invocation of this Countermeasure Injury Compensation Fund during the pandemic for COVID vaccines and countermeasures. And there were a handful of articles that have been published. I don't want to repeat the findings there, but many talked about lack of transparency, lack of accountability, high administration costs, and again, really high barriers for proving causation for injuries there. Now, shifting more towards what a research injury compensation fund must look like. Again, there have been a lot of great articles written recently. One of the members, Leslie Henry, of course, has written a lot about this. She knows much better than me about this type of funds. I want to focus in on the three questions that the committee asked the panelists to think about. The first question was about concerns of research participant priorities. Now, there are many. I think some of these concerns include receiving a very thorough and honest assessment of research-related risks prior to enrollment. Of course, that should be wrapped up in IRB approval and informed consent forms. But one part I think that really could be worked into a system is looking at timely and accurate research assessments as the research is ongoing and after the research is ended. I remember, just a few minutes ago with the UW program, it was curious to see that it seemed like some of the compensation kind of stopped, or at least the timeline stopped when the research ended. So I think it's important, especially when we're talking about research participants who are pregnant or who are lactating, to think about latent effects, long-term effects. So again, I think there is an ethical obligation to require the researchers to conduct long-term follow-on studies to see if the research participants have encountered any ongoing or long-term risks. Now, with the second question posed by the committee, what constitutes fair compensation? One, I think, relates to health surveillance, right? So have the research participants or their children, right, because we're talking about pregnant persons, have, surveilling them as, again, long after the research has been conducted. And I don't think the research participants or the children should bear the cost of that. In line with the surveillance, of course, if there is a research-related injury, costs of healthcare seem like low-hanging fruit for what should be encompassed in a research compensation program. But I also think it's ethically appropriate to go beyond the actual healthcare costs and think about reimbursement for time off work, costs of travel to and from the appointments. And the trickier question, I think, is to look at, what the law would call economic or non-economic damages. So again, just kind of a 2-minute overview here. Tort law will draw a line between the two. Economic damages are things like lost wages, whereas non-economic damages are things like pain and suffering. So again, the question becomes, how much should a research injury compensation program take into consideration not just the healthcare costs, but other harms that are suffered by these research participants due to research-related injuries? And this ties in, I think, to the third question posed by the committee, which is how exactly to design a scheme that protects research participants. So again, I think part of the designation needs to be part of the informed consent process, detailing specifically to the research participants prior to enrollment what compensation will look like. The committee may want to think about adopting a minimum amount for economic damages that would take into the account that many research participants may not have a job, and that this idea of thinking about economic damages, lost wages, is you may not have a job as you're enrolled in the study, but you may have one later on, or at least be planning on having one later on. So again, I think it may be interesting to think about a minimum amount for economic damages kind of as a baseline. With respect to non-economic damages, I think this is very tricky. I think it might be worthwhile to look at a tiered approach where you look at the severity of the injury and then different range of amounts that would be available to an injured research participant. I think the last thing you want is every case being, quote, litigated one-on-one to see exactly what are the non-economic damages. That would kind of take away from the efficiencies in having a research compensation fund. So that's one idea, is to think of it as a tiered approach. Now, again, I think one last point I'll raise is I think it's important to keep in mind that, especially with pregnant and lactating persons who volunteer for studies, part of the reason they may be volunteering is to get paid and to get access to care that they otherwise might not have. And again, I think this adds another layer of vulnerability to the research participants that must be factored into a compensation fund. And again, just one way to think of it more holistically. So I'll stop there. Thank you again for the invitation to speak, and I'm looking forward to the question and answer period and the discussion.